guys, this is Jennifer Timmerman, and I'm the Student Retention Coordinator at Covenant School of Nursing. I talked to you very briefly during orientation, and I know I posted a Lassie assessment for you guys to take. That was due Friday, but we haven't spoken since orientation, so I hope everybody's doing well and adjusting and all those good things. So let's just go back for a second. This lecture, if you will, is supposed to be informative as far as the types of questions you'll see on exams. There are some tips I'm going to go through that will help you determine the right answer. And so sometimes in what we've noticed in nursing school is you know the content really well, but sometimes it seems like the questions can trip you up a little bit. They can be pretty complex, or you have to prioritize, or there's a ton of critical thinking. And so these tips are designed to help you focus on what's really important. And so what I would also say is taking the test itself, using these tips is like 25% of the work. The other 75% is studying. I would recommend you study every day. It's also self-care, sleeping the night before a test. You know, they say that driving in a sleep-deprived state is almost as bad as driving under the influence in relation to your speed of reflexes. So, would you take a test after you'd had a couple drinks? Probably not, because this is really important. This is a goal you've set for yourself. So I would advise you to get 6 to 7 hours at least the night before an exam. Study in advance so you don't have to stay up all night cramming, and you'll do so much better. Another thing, don't have 12-hour study marathons. It's not good for your brain. It's great. It's a great idea to study for 45 minutes and then get up and move around, do something not related to school, or I don't know, catch up on laundry, go for a walk, that kind of thing. So, study, self-care, preparation, all of those things contribute to success. So, this is Bloom's taxonomy, and it's kind of a visual of the types of questions and how they get harder as you progress through any education, really. So, remembering level questions, this is very much like labeling a diagram in A&P. So, in the anatomy portion, let's say labeling the valves of the heart on a diagram, right? You memorize that, you regurgitate it, easy peasy. Understanding level questions would be assessing whether or not you know what those do, what the valves of the heart, their purposes are. Application questions might be assessing a patient, hearing a murmur, and knowing that it's a mitral valve. So there's a mitral valve prolapse. So there's a ton of, you have to know your anatomy. You have to know where you hear the mitral valve. You have to know what that murmur would sound like, so on and so forth. And so with each level, you have to use a little bit more information to answer the question. So most of your questions during this module are remembering understanding with some application level questions. So the commandments of test taking, and I'm not going to read all of these. What I'm going to do is just jump right in and we'll get started with the commandments themselves. I can't take credit for that. That's a Dr. Kidder thing. She developed the commandments of test taking years ago. I've tweaked them a little bit, but they are her commandments. So number 1, reword the question in 2 or 3 words. What's the question asking? And sometimes this is hard to reword into just a couple of words and still have a sentence or still have a question. So we're gonna play with that a little. A patient is incontinent of loose stools and is cognitively impaired. Which action should the nurse implement to help the patient prevent skin breakdown? So, if I were going to reword this question, I would probably say, let's see, a patient is incontinent. How do I prevent skin breakdown? So, stuff that stands out, I know I have a patient who is having uncontrolled bowel movements, and I know that I'm trying to prevent skin breakdown. The cognitive impairment, well, that kind of stands out to me. I'm going to put that on the back burner because I don't know it. I just don't know that I'm going to need it to answer this question. So my options are wash the buttocks with strong soap and water, bathe immediately after a bowel movement, place the call light within easy reach, or put a pad under the buttocks. Now, let's see. Wash the buttocks with strong soap and water. So most students, when they read that, they say the strong soap is off-putting. They don't like the idea of strong soap, and they are absolutely right. Let's eliminate that. Bathe immediately after a bowel movement. Now, this is actually the correct answer. And what people often say is, well, when it says bathe, I think a head to toe bath, like put them in the shower or, give them a complete and total bed bath. And that's not necessarily the case, but let's set it aside for a second and look at your other options. Place the call light within easy reach, put a pad under the buttocks. So as far as your call light option is concerned, many students will say, well, the patient's cognitively impaired. They're not going to know how to use the call light. And I would remind you that it doesn't tell me how cognitively impaired, and we're still going to reinforce how to use that call light. So that is a safety issue, and absolutely you would want to put that within your easy reach. But it's not preventing skin breakdown. It's not a first line defense against skin breakdown. Putting a pad under the buttocks. A lot of people jump on this answer. And think about it from the perspective of, why did we put that pad under the buttocks? Is that to help the patient? Or is that to help us? So the perspective there is that we do that to protect our linens. So if the patient is incontinent, it's going to collect whatever urine, hopefully stool, on that pad. We can change the pad out, wipe the patient down, and put a new pad under without actually having to remake the entire bed. So when you look at why to eliminate 1, 3, and 4, even though number 2 doesn't look, even though the word bathe, we don't really like that, can you see how that is the only answer that left that's a potential correct answer, because we've disproven everything else? Okay, number 2, avoid asking what if. So you, the nurse, you're going to plan to meet the hygiene needs of a hospitalized patient who's experiencing hemiparesis because of a brain attack or cerebrovascular accident or stroke. Those are all words for the same physiologic state. Which is an appropriate nursing intervention? So the things that stand out here, we've got hemiparesis. It doesn't tell us which side, so I guess we don't need to know that. Patients had a stroke, and I'm trying to meet their hygiene needs. Okay, so I can assist with the bath as needed, give total assistance with a complete bath, provide minimal supervision during the bath, or encourage a family member to bathe the patient. Let's start with that fourth one and work our way up. So, encouraging a family member. We don't do this. The only time I can think that we encourage a family member to bathe anybody is in the newborn nursery after a baby's born. That's about it. Now, if a family member wants to help and the patient's okay with it, they can help, but we don't ever put our tasks back on the family. People pay really good money for nursing care, and so it's part of your job, and it's also a great time to assess and get to know the patient and whatnot. Provide minimal supervision during the bath. Minimal supervision. That sounds dangerous, so I would say let's eliminate that. Now, giving total assistance, that's like the opposite of minimal supervision, and that says total assistance is I'm going to do it for the patient. And that seems a little overboard. Remember, we want to give people as much autonomy as possible. So the choice that's left is assist with the bath as needed, which is a great answer because you allow the patient to do what they can do and you fill in the blanks. And so if they're paralyzed on their right side, then you're going to help them wash their left side because they can't reach across with their right arm to wipe down their left arm, if that makes sense. So let's see. Strategic words. Oh, I love these. Immediate, initial, first, priority. Anytime I see these, it's like a hint to me that I've got 4 right answers. I'm going to do all those things, but I have to find the most right answer, or what I'm going to do first. So our question is, what should be the nurse's first intervention after removing a bedpan from under a debilitated patient who's just had a bowel movement? You can document results, provide pericare, reposition the patient, or cover the patient with the top linens. So, I've just removed a bedpan. Patient had a bowel movement. What do I do first? Well, it's rare that you're going to document first. So let's go ahead and just eliminate that guy. Now we've got provide pericare, reposition the patient, or cover the patient with the top linens. A lot of students, they will choose either 2, 3, or 4. And they choose 4 because they want to protect the patient's privacy. They choose 3 because they're thinking they're still going to have to roll the patient so that they don't dirty the linens. And they choose 2. 2 is actually the correct answer because you do want to provide pericare. One thing that's important here is visualization. So if you have had any teaching on bedpans, you know that a normal bedpan is kind of a big thing, and you roll the patient on their side and put the bedpan under their bottom or beside them and then roll them back onto it. And then when it's time to get off of the bedpan, you have the patient again roll to the side. You carefully remove that bedpan so that nothing's spilled, and you clean the patient up. And so if you can visualize those steps, then you'll remember, oh, hey, I don't have to reposition the patient. They're already repositioned. They're on their side. I just need to get them cleaned up. Now, I love that people try to protect privacy, but number 4 is wrong because, even if you were able to partially cover the patient with a towel while you cleaned him up, that's fine. But the top linens, you don't want to have to change those out because you've got stool on them. So if we did try to cover the patient, it would be with towels or something of that nature. The subject of the question. So this one, the nurse is teaching a patient in skeletal traction about measures to increase bed mobility. Which items would be most helpful for this patient? And that makes it look like a select all that apply, but it's not. So that needs to be reworded. But we have options of television, fracture bedpan, overhead trapeze, and reading materials. And when we look at that, it seems like everything on there would be very helpful. Skeletal traction is like it's a pulley system. And so if you think about like on TV if somebody gets hit by a bus and they're in a head to toe cast and they have they're laying in a hospital bed and one of their legs is extended and it's hanging from a pulley system, that's skeletal traction, and it's designed to put weight and to pull those bones back into alignment. And when somebody is in traction, of course, they're not very mobile. So, will a television help with mobility? No. Will a bedpan help with mobility? No. An overhead trapeze would help with mobility. Reading materials would not. So an overhead trapeze is a triangle suspended from a chain that the patient can reach up and grab so that they can reposition themselves in the bed. And that is what out of this list would directly affect mobility. The process of elimination. So we have a nurse who's helping a patient who has right hemiparesis to get dressed. Which action should the nurse implement first? Now, hemiparesis is one-sided paralysis, right? So this person is paralyzed on the right side. They can't use it, and you're helping them get dressed. So you can either put the gown's right sleeve on first, keep the patient in an open backed gown, encourage the patient to dress independently, or leave the right sleeve off while adjusting the tie at the neck. So let's imagine some of this. First of all, putting the gown's right sleeve on first. Remember, you're helping them. And so you're gonna, if you've played with those gowns, you know they're terrible. It's like, I don't know, it's a puzzle as far as how to get them together. But you're going to do the snaps on the arms, and you're gonna go ahead and slide the right sleeve over the right arm. Okay? And after that, the patient can lift their left arm, they can put that sleeve on, and you can tie it in the back. Easy peasy. That is actually the correct answer. Keep the patient in an open backed gown. I don't know how this is helpful, other than I guess you would just lay the gown on top of them and not tie it. But that does not protect patient privacy and not good practice there. Encourage the patient to dress independently. That's really difficult to do when you have paralysis on one side. So, not the correct answer there. And you can leave the right sleeve off while adjusting the tie at the neck. Now, if you imagine the gown dangling from the left arm and the neck, it's not covering anything up. So that is not a great answer choice there. But the correct answer again is put the gown's right sleeve on first. Okay, we're going to do some quick reviews. ABCs. You remember ABCs or BAC from CPR class, right? So ABC stands for airway, breathing, and circulation. And I know the American Heart Association went back and they rearranged some things for the layperson. And so when the layperson takes CPR, we want them to start with circulation because chest compressions are found to be the most effective intervention. However, in the hospital setting, you're still going to prioritize airway, breathing, and then circulation. So, I have no idea why this is. I'm just reading the slide and I'm seeing that it's actually a rationale for another question. Whatever, we're still going to talk about it. Okay, so airway. How do we assess airway? I don't think you guys have had assessment yet, but just looking at a person, you can see their chest rising and falling. Or if I'm talking, you know I have to have a patent airway, meaning there's nothing blocking my airway. Now, we assess breathing by listening to breath sounds, by checking the oxygen saturation on the finger. We assess circulation by checking for pulses, capillary refill, that kind of thing. So, you always, if airway is an option in any question, take a closer look at it. Doesn't necessarily mean that it is the correct option, but there's a great chance. Airway is often a viable option. So let's skip forward. A nurse is assessing a patient who says, I think I have a bad cold. The nurse assesses the patient's vital signs, performs an inspection, and takes a history. What assessment should the nurse perform next? They can auscultate the lungs, palpate the abdomen, obtain the apical heart rate, ask the patient where they hurt. Okay, so I'm gonna be really obvious here, and I'm gonna point out that auscultate the lungs is an assessment of airway and breathing. Boom, there you go. It also makes the most sense because when somebody says, I have a bad cold, well, what comes to mind? Respiratory symptoms. And so the next assessment would be respiratory assessment. We're not necessarily going to palpate the abdomen if we're doing a focus review. The apical heart rate is not important here. We've already gotten the patient's vital signs, and it doesn't say they have an irregular heartbeat. And we're not going to ask the patient where they hurt. So the most logical assessment is to auscultate the lungs. Okay, Maslow. How exciting. So you guys all had developmental psychology or some form of that, and you've heard of Maslow, I'm sure. Maslow proposed that our needs can be categorized in the shape of a pyramid. And so on the bottom we have physiological needs, and those have to be met. Many people believe that you have to have your, one step met before you can progress to the next step. That's not necessarily true, but for the most part, you can't feel safe if you don't have food, water, and shelter. So, physiologic needs, bottom of the pyramid, most important stuff. Okay, breathing, food, water, shelter, clothing, sleep. Once those needs are met, we go to the next level, and that's safety and security. So there's two types of safety, and I know it doesn't reflect this in the pyramid, but I think it's an important consideration. There's physiological safety and there's emotional safety. Now, when I say physiological safety, I mean like you live in a war zone and you are constantly worried about bombs being dropped on your head. Okay, that's a physiologic problem. But consider the kiddo who's being bullied at school. And so it may not be physical, it may just be that they are being excluded or they're being made fun of. That is a very real threat to safety and security. And so I want you to remember that psychological threats also need to be taken seriously. Health, employment, property, all of those things fit. And so when we talk about safety and security in nursing, most of the time you're going to see references to having the wheels locked on the bed and the bed in the lowest position, call light within reach. All of those are about safety. Physiologic needs are going to be about the patient eating their meals or protecting their sleep or healing. So, love and belonging is about feeling as though you're part of a group. And so the nursing questions we encounter about love and belonging will be facilitating those connections. And so that might be allowing the family to visit, it might be putting cards from the grandkids on the wall where the patient can see them, stuff like that. As self-esteem is towards the top there, and really this is about providing the patient with autonomy. And so let's say we've got a patient who had an amputation and they're having a hard time adjusting, and you want to know when to do their ADLs, their activities of daily living. Well, giving them an option, giving them some power to choose can really be boosting to their self-esteem. And so self-actualization we're not going to talk about because we often in the hospital, most people are not working on self actualization, they're working on physiologic needs or they're working on safety and security. Self actualization is the state where so many of your needs have been met, you can look outside of yourself and you can work on creativity. You're spontaneous, you adjust well to situations. And that's not me on a good day. So, anyhow, when you encounter these things in a question, in a nursing school question, the first thing you do is you look for physiologic needs. And if there are no physiologic needs, then you say, okay, safety and security. Is there something that addresses safety and security? And so on. So let's do a sample question. Which statement made by a nurse meets a second level need according to Maslow's hierarchy of needs? I see that you've applied makeup today for the first time since you had your surgery. Okay, that is a comment on self-esteem. Somebody putting on their makeup or fixing their hair is a marker of self-esteem, is working on self-esteem. Whether or not their self-esteem is great, that's not relevant. It's that they're trying. Let's see. I am your nurse for the next 12 hours. You can use your call light to page me. That is really about safety and security. So let's see what else we have. Your family can visit every day between 10 in the morning and 8 at night. Okay, that's about love and belonging. That's family, facilitating those visits. And finally, a physical therapist will be in today to complete an evaluation. Okay, that one. That's about a physiologic need. So this is about getting a patient up and walking. PT is going to evaluate them and they're going to move around. So let's go back to the question. Oh, we're looking for a second level need. So see, I miss important parts of questions because I read fast and don't pay attention. I would have missed that because I was looking for a physiologic need. So second level is safety and security. And so we had that at the call light. Number 2 is the correct answer. Okay, the nurse has developed a plan of care for a client diagnosed with anorexia? Which client problem should the nurse select as the priority in the plan of care? We've got malnutrition, inability to cope, concern about body appearance, or lack of knowledge about nutrition. So, do we see, I guess when we read this, we're looking for the priority in the plan of care. I'm going to use Maslow's to answer it. I'm going to look for a physiologic need first because that's the base of the pyramid. And so the only physiologic need I see is malnutrition. Inability to cope is a psychological issue. Concern about body appearance is also psychological. Lack of knowledge about nutrition, that's really not even true because most of your patients with anorexia are very knowledgeable actually about what goes into their bodies. So our correct answer is malnutrition. And finally, the nursing process. I doubt you guys have had this lecture before, and so we'll just kind of go through it quickly, and you can come back to this once you've had the lecture. So, nursing process consists of assessment, analyze or diagnosing, planning, implementing, and evaluating. So, whenever you come across a nursing question and the question is, what does the nurse do first? I want you to think that the first thing we do is assess. So if you look at the list and you see an assessment, take a closer look at it. It's not always the right answer. Sometimes you are prioritizing interventions, but sometimes it's you need to gather more information, and we do that through assessment. So let's go forward. A client who's had an application of a right long arm cast complains of pain at the wrist when the arm is passively moved. The nurse should first elevate the arm, document the findings, medicate with an additional dose of an opioid, or check for paresthesias and paralysis of the right arm. Okay, so a right long arm cast is above the elbow all the way to the wrist. Passive movement is when I take the patient's arm in my hands and I rotate it, I move it a little, and the patient says that hurts. So the only option that's an assessment option is number 4, to check for paresthesias and paralysis of the right arm. Paresthesias are like pins and needles. Okay, so 4 would be our correct answer. The other ones are, it's likely that we would do them. We would elevate that arm. We might give something for pain. We would probably document the findings, but the first thing we would do is assess further. Recognizing expected outcomes. This is important when you are answering questions about medications or the follow-up after you've completed certain nursing interventions, or patho, knowing what something does to the body. So the nurse is caring for a client who has a fever and is diaphoretic. The nurse monitors the client's intake and output and expects to note which finding. The client's urine is diluted. The client's output is decreased. The client's urine production is increased. The client's majority of fluid loss is through the skin. So 2 of these things are very much alike. 1 and 3. Often when urine production is increased, the urine is more dilute. And when somebody has a fever and they're diaphoretic is sweaty, right? And so you're losing moisture through your skin. Is your urine going to be dilute, or is it going to be more concentrated because you're losing water in other places? It's going to be more concentrated. So let's eliminate 1 and 3. A lot of students like 4, the client's majority of fluid loss is through the skin, because that's kind of, fluid loss through the skin is the definition of diaphoretic. However, I'm monitoring the client's intake and output, and I note which finding. If you haven't seen an intake and output record, you will soon. There's no place on there for diaphoresis. There's no way to measure. How do you measure how much somebody is sweating? Okay, you can talk about how often you change the sheets on the bed or, something of that nature. But for the most part, that's going to be difficult to measure. So let's eliminate that. Number 2 is the correct answer. The client's output is decreased. And that would make sense, right? Because if they're losing fluid, if they're sweating, then they have less fluid that goes through the kidneys. Okay, so their output is decreased. Okay, eliminate comparable or like options. And so we kind of just did that on this last slide. This one is a little bit harder. A nurse working in a clinic is assessing patients of a variety of ages. People within which age group should the nurse particularly assess for subtle signs and symptoms of subclinical infections? We have children of school age, older adults, adolescents, and infants. Those are our choices. Okay, so if we're looking at these, are there two that are physiologically similar? Well, when I look at this list, children of school age and adolescents stand out to me. They are in the middle of the spectrum, and infants and older adults have so many outlying variables about their physiologic states that I'm going to eliminate 1 and 3 because they are the most similar. So I'm left with older adults and infants. And subclinical infections are infections that don't present like we expect them to. And so the big, like, older adults is the correct answer. And the best example of this is UTIs in older adults. Often, we expect UTIs to present as burning with urination and maybe pain in the pelvis and whatnot. And with older adults, the first symptom is often confusion. And for whatever reason, I always think that perhaps the immune system changes as we age. I mean, infants spike temperatures of 103, 104, and younger kids do the same. But as we age, our temperature doesn't really get as high. I mean, think about the last time you had a temperature of 103. It doesn't happen very often as adults. So I think our immune system just changes as we age. Closed-ended words. There are so few absolutes in nursing. So closed-ended words include only, never, always. Anytime you see an absolute, take a closer look at it. So which should the nurse do to interrupt the transmission link in the chain of infection? Wash the hands before providing care to a patient. Always position a commode next to a patient's bed. Provide education about a balanced diet. Change a dressing only when it is soiled. Okay, so I see always, 2. Okay, there's number 2 is eliminated because I see always position a commode next to a patient's bed. That's not necessary. May not always be necessary. Number 4, change a dressing only when it is soiled. We also know that that's not true. I mean, we have prescribed dressing changes daily or twice a day or whatever, and I mean that's not an absolute that we can support. So we're left with 1 and 3. Now, balanced diets are good, washing the hands are good, but if we're interrupting the transmission link in the chain of infection, that's supposed to be chain. If we're interrupting that link, we should wash our hands. Washing hands is the correct answer. Okay, finally, we are going to look for the umbrella option. So the umbrella option is a broad universal statement that usually contains the concepts of the other options within it. You, the nurse, are caring for a confused patient. Which should the nurse do to prevent this patient from falling? Encourage the patient to use the corridor handrails, place the patient in a room near the nurse's station, reinforce how to use the call light, or maintain close supervision. With these options, the umbrella option for me, the option that contains the others, is maintain close supervision. So if I'm encouraging the patient to use the corridor handrails, I'm keeping an eye on them. I'm right there, encouraging them to use the handrails. Placing them in a room near the nurse's station, also maintaining close supervision. Reinforcing how to use the call light, Also part of safety and security, maintaining close supervision. So number 4 contains the other 3 options. Okay, finally, a word about select all that apply. If you haven't had a test yet, select all that apply. They are the bane of my existence. I'm not sure about you, but you will have increasing numbers of select all that apply questions on your exams. You have to treat each answer choice like a true false. And so cover up 2 through 5, read number 1. Is it true or false in relation to that statement? So our question is, a patient tells the nurse, I think I have an ear infection. The nurse should assess this patient for which objective human responses to an ear infection. Select all that apply. You should see select all that apply. Anytime there is a select all that apply question, it should say select all that apply at the end. Okay, so the important keywords here, I'm looking for objective human responses. So subjective is something I can't see. The patient has to tell me about it. But objective human responses, well, that's something I can actually see. So number 1, is that true or false? Throbbing pain. That's false. The patient has to tell me about it, so it's not objective. Number 2, purulent drainage, true or false? Purulent is green, infectious drainage, sign of infection. That's true. I can see that. Number 3, elevated temperature. True or false? True. I can assess a temperature. Number 4, dizziness when moving. True or false? It's actually false. There's a lot of things that can cause a gait disturbance, and I can't assume that it's dizziness if the patient's walking and they're having a hard time. That's something the patient has to tell me. So I know a lot of students want to pick dizziness when moving, but in reality, only the patient can tell me why they're walking like they're dizzy. Number 5, hearing a buzzing sound. True or false? That is false because that is subjective. So we had 2 and 3 for correct answers. Okay, so we're going to stop there. I know there's some more select all that apply questions following this one, but they get a little more complex as you go, and so we'll stop. I intend to have a little question and answer session, perhaps I think we'll do 12:30 on Monday. So I'll give you some time to look this over, and then if I can find some more practice questions that kind of go along with what you'll see on the test on Monday, I may bring those with me. So hopefully I will see you guys at 12:30.